Welcome to the recorded version of Living at Home with Arthritis, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Handling the main portion of the presentation is going to be Lori Owen. Lori has 10 years of experience working at Home Instead Senior Care. In her current role, she works with a team responsible for ensuring that the Home Instead Senior Care Network's 60,000 caregivers worldwide have the resources necessary to effectively provide quality care in the home and understand the importance of their work enhancing the lives of those they serve. She is responsible for developing training for Home Instead caregivers and has worked as a caregiver trainer advisor to provide that training. Joining us later on in the presentation for the Q&A section is going to be Dr. Eric Otterberg. Dr. Otterberg graduated from the University of Michigan Medical School and completed his residency at the University of Nebraska Medical Center, Creighton Orthopedic Foundation. He completed a fellowship in hip and knee replacement from Massachusetts General Hospital and Harvard Medical School in Boston, Massachusetts. And we're going to be welcoming Dr. Otterberg onto the call later on. But at this point, I would like to turn the floor over to our main presenter, Lori Owen. Thank you for joining us.
Thank you, Steve. I'm really glad to be here. So hello, everyone. Like Steve said, I'm from Home Instead Senior Care, and I'm going to be talking about arthritis. So, as familiar as we are with the word arthritis, many of us don't fully understand what it is. Actually, arthritis refers to more than 100 different diseases that cause pain, swelling, and limited movement in joints or other parts of the musculoskeletal system. Many forms of arthritis are chronic, meaning that they can last for a lifetime. And the limitations caused by arthritis certainly can affect a person's quality of life, and some forms of arthritis can actually be life-threatening. And unfortunately, there's still not a cure for arthritis. In this webinar, we're going to focus on 4 forms of arthritis. They are osteoarthritis, rheumatoid arthritis, juvenile rheumatoid arthritis, and fibromyalgia. Osteoarthritis is a degenerative disease characterized by the breakdown of joint cartilage. It is the most common form of arthritis, affecting nearly 21 million Americans, most over the age of 45. Rheumatoid arthritis, also called RA, is a systemic disease that affects the entire body and is characterized by the inflammation of the membrane lining the joint, which causes pain, stiffness, warmth, redness, and swelling. In the United States, nearly 2.1 million people have rheumatoid arthritis, and there are two and a half times as many women as men with RA. Juvenile rheumatoid arthritis, or JRA, affects children under the age of 18 and varies in its severity. There are at least 3 forms of JRA. One is called polyarticular, which includes inflammation of the small joints of the fingers and hands. Another form is pauciarticular, which includes inflammation of the large joints and affects 4 or fewer joints. Frequently, there is also eye inflammation. And the third form is systemic, which affects the child's internal organs as well as the joints and is associated with high fevers. Finally, the 4th form of arthritis that we will be discussing today is fibromyalgia, which affects mostly women, is an arthritis-related condition characterized by widespread muscle pain and the presence of tender points or areas of the body that are particularly sensitive to pressure. Arthritis is quite common. 50 million Americans have doctor-diagnosed arthritis, and by 2030, that number is estimated to grow to 67 million. Of those currently diagnosed, more than 21 million have arthritis-related activity limitations. As a result, arthritis costs the U.S. economy $128 billion in lost wages and productivity annually. With that as a background, let's talk about the objectives for this webinar. Moving on to the next slide. During this webinar, we are going to discuss several important things related to arthritis, First, we will begin by talking about the symptoms and warning signs of arthritis. Some of these will likely be familiar to you, and others may surprise you. Then, we will talk about how arthritis is diagnosed and the kinds of medical specialists who can help people suffering from arthritis. Then, we will talk about some of the common treatments for arthritis, and we will end by reviewing tips for preventing arthritis as well as tips to make it easier to live with arthritis. Let's start with the symptoms and warning signs of arthritis. Moving to the next slide. We are going to talk about the symptoms and warning signs for 3 different types of arthritis. Let's start with osteoarthritis. Osteoarthritis symptoms often develop slowly and worsen over time. They can also range from mild to severe. Usually the joints affected by osteoarthritis ache or become painful or stiff first thing in the morning or during or after use. Joints may also be stiff after periods of inactivity. Therefore, it's important for people to remain physically active despite any initial discomfort they may feel. Exercise keeps the joints moving, which helps them stay lubricated. It also builds strength in the muscles surrounding the affected joint, so the muscles can better support it. Now, let's talk about rheumatoid arthritis. Next slide. Rheumatoid arthritis, also called RA, is different from osteoarthritis. RA can affect body parts beside joints, such as eyes, mouth, and lungs. With RA, the person's joints may feel warm to the touch, and they may notice a decreased range of motion, as well as inflammation, swelling, and pain in the areas around the affected joints. Rheumatoid arthritis is symmetrical, meaning if a joint on one side of the body is affected, the corresponding joint on the other side of the body is also involved. Because the inflammation is systemic, the person with RA is likely to feel fatigued, and they may become anemic, lose their appetite, or run a low-grade fever. Finally, let's look at the symptoms and warning signs of fibromyalgia. Slide. Fibromyalgia, which affects up to 6 million Americans, causes not only pain around the joints, but also tenderness in muscles and nerves, as well as sleep problems that leads to symptoms of severe fatigue. The widespread pain and severe fatigue can disrupt the person with fibromyalgia's ability to function at full capacity on a daily basis. A possible cause of fibromyalgia is an altered function of the central nervous system. The American College of Rheumatology's guidelines for diagnosing fibromyalgia require a person to have widespread pain throughout their body for at least 3 months. They define widespread as having pain on both sides of the body as well as above and below the waist. Someone with fibromyalgia may experience signs and symptoms that are seemingly unrelated to fibromyalgia, such as chronic stomach aches or headaches. Fibromyalgia can mimic or even overlap many other conditions, such as rheumatoid arthritis, lupus, multiple sclerosis, or sleep apnea. Now that we have reviewed the symptoms and warning signs of 3 forms of arthritis, let's now take a look at how arthritis is diagnosed and the kinds of medical specialists who can help someone with arthritis. Slide. It's important to remember that arthritis refers to more than 100 different diseases that cause pain, swelling, and limited movement in joints or other parts of the musculoskeletal system. The key to successful treatment is early diagnosis and the implementation of an appropriate treatment plan. One of the key factors people should be aware of in determining when they should seek medical treatment is swelling or stiffness in joints that lasts for more than 2 weeks. If that occurs, they should make an appointment with their primary care doctor. If possible, they should keep a symptom diary for several weeks before the appointment. By doing so, it can help track pertinent facts about their condition and also help them track changes that may occur. When physicians diagnose arthritis, they do so based on several factors: the overall pattern of symptoms, medical history, a physical exam, and imaging studies such as X-rays and MRIs, and bone scans and laboratory tests. So let's talk about some of the more common tests. One blood test looks for the rheumatoid factor. This is an antibody which is present in about 70 to 80% of adults who have rheumatoid arthritis. A doctor will also likely order a sedimentation rate or a SED rate. This test is an indicator of the presence of nonspecific inflammation in somebody's body. A step up from the SED rate is the C-reactive protein test, or the CRP. The anti-CCP is another blood test which has become more commonly used and is ordered if rheumatoid arthritis is suspected. A doctor may also order X-rays of the patient's bones and joints, or may also require an MRI, which can give more precise information about bones and joints as well as soft tissues. Once the tests are complete, the primary care practitioner may refer the patient to a specialist. The three most common types of specialists are rheumatologists and physiatrists and orthopedic surgeons. Rheumatologists are arthritis specialists. They are medical physicians who have finished a residency in internal medicine and a fellowship in rheumatology. Physiatrists are physicians who have specialized in physical medicine and rehabilitation. And orthopedic surgeons are the professionals who will perform surgical procedures such as joint replacement. So now let's talk about common treatments for arthritis. There are several common treatments for arthritis. For example, the use of heat or cold over joints or muscles may give people short-term relief from pain and stiffness. But often, the most common first line of defense are over-the-counter aspirin or other non-steroidal anti-inflammatory drugs, also known as NSAIDs. These drugs have immediate pain relief and anti-inflammatory effects and are relatively safe. Although, like any drug, they can have side effects and can interact with other over-the-counter and prescription drugs. So their long-term use should always be discussed with a physician. Because of the prevalence of arthritis, many prescription drugs have also been developed. Biologics are the most recent breakthrough for the treatment of rheumatoid arthritis. Administered by injection, these drugs have been found to dramatically improve quality of life for people suffering from rheumatoid arthritis. Corticosteroids, also known as steroids, suppress the immune system and symptoms of inflammation. They are often injected into painful osteoarthritic joints and are used to treat autoimmune forms of arthritis. However, because of the potential for serious side effects, people should avoid taking steroids for a long period of time or in high doses. Regardless of whether the medication is over-the-counter or prescribed, it is important that it be taken exactly as directed by the physician and that side effects be reported immediately to the prescribing physician. Many people suffering from arthritis find that lifestyle changes can also greatly improve symptoms from osteoarthritis and other long-term types of arthritis. For example, losing weight and eating a better diet can offer immediate help. In addition, self-help aids have special features that help make everyday tasks easier. Exercise can lessen the pain, increase strength and movement, and reduce the fatigue associated with arthritis. A physical therapist can recommend exercises and give advice on how to reduce strain on joints and conserve energy. And lastly, getting enough rest and relaxation is also important. If lifestyle and medicinal treatments are not effective, there are one or two surgical options. Option A is to inject the arthritic joint with a man-made version of a joint fluid which can help relieve the pain. Option B may be surgery to rebuild or replace a joint affected by arthritis. Both of these treatments can greatly improve the quality of life of arthritic patients. Alternative therapies such as acupuncture, meditation, aromatherapy, magnets, and herbal remedies may offer results in conjunction with traditional therapies. It's important to plan these alternative therapies in consultation with a physician. Next, let's discuss tips for preventing and living with arthritis. There are a number of things people can do to prevent arthritis or improve their quality of life if they already have arthritis. According to the Arthritis Foundation, one of the best ways for all of us to protect our joints is to maintain an ideal body weight. The more someone weighs, the more stress it puts on their hips, knees, back, and feet. When lifting or carrying something, it's best to use the largest and strongest joints and muscles. This will help to avoid injury or strain on the smaller joints. When sitting, the recommendation is to not be static. Changing positions regularly will decrease the stiffness in muscles and joints. Eat right, which means adding more veggies, fruits, nuts, teas, and even chocolate into our diet. Many plant-based foods contain antioxidants and phytochemicals, which may reduce joint inflammation. It's also important to load up on omega-3 fatty acids found in fish such as salmon and tuna. Research has shown the importance of vitamin C and other antioxidants in reducing the risk of osteoarthritis and its progression. Oranges and other citrus fruits are a good source of folic acid, which can help alleviate the side effects of some medications. Other good diet and lifestyle ideas include reducing red meat intake and quitting smoking, both of which have been found to increase the incidence of rheumatoid arthritis. It is also important to have a regular exercise program. Exercise protects joints by strengthening the muscles around them. Strong muscles keep joints from rubbing against one another, wearing down the cartilage. A good workout should include flexibility, aerobic, and strengthening exercises. Of course, it's best to consult with a doctor, physical therapist, or other specially trained health professionals to develop the best individualized exercise routine. There are also tools that can help make the day-to-day living easier for people with arthritis. From Ziploc bags to specially designed food product containers, and from specialty knives to upright vacuum cleaners. The Arthritis Foundation keeps and updates a list of products they make that make living more simple. And you can find a full brochure listing these at www.arthritis.org. In the workplace, there are options for people with arthritis that make the workday easier. These include using electric versus manual devices. An electric stapler is a good example. In addition, they may need to explore the option for flexible work hours, telecommuting, or working part-time. It is important to take frequent breaks to stretch stiff joints and sore muscles. You know, arthritis doesn't just impact the person who is suffering with it. It can also have a significant impact on family members and family caregivers. Let's talk about how some resources we can recommend to both the person with arthritis and/or their caregivers. Slide. Caring for a senior loved one who is suffering from arthritis can be a tough responsibility, depending on the level of disability. It can carry a host of difficult decisions and issues which the family member may have little or no experience with. Too often, caregivers feel overwhelmed, isolated, and trapped. It is the intent of the Arthritis Foundation to help ease this burden by offering topical advice and resources. In the caregiver section of the arthritis.org website, they can get more information on how to talk to their parents, assess their level of independence, work with health professionals, help manage medications, cope with pain, manage financial and legal issues, deal with transportation issues, make the home safe, and get in-home monitoring, determine when a move is necessary, and provide long-distance caregiving. The varying forms of arthritis limits everyday activities such as walking, dressing, and bathing for more than 7 million Americans. The Centers for Disease Control and Prevention said arthritis is strongly associated with major depression, most probably because it can create functional limitations. Easing anxiety, reducing emotional distress or depression, and getting better sleep may help reduce pain, improve the ability to enjoy life again, increase the ability to cope, and improve psychological well-being. According to the American Pain Society, these are the main goals of chronic pain management. Caregivers should be encouraged to learn all they can about pain management. They can also act like an advocate for a senior loved one by helping him or her keep an ongoing pain log. This log will prove to be a valuable tool in gauging their progress and assessing the success of his or her treatment. On its website, arthritis.org, the Arthritis Foundation lists a number of psychotherapy techniques to help tune out or turn down arthritis pain, including hypnosis, biofeedback, and cognitive behavioral therapy. Support groups are another option and have been beneficial to many people living with chronic diseases. Caregivers also need to make sure they take care of themselves. It's incredibly difficult to watch someone you love suffer from a painful condition that never ends. Therefore, we need to encourage caregivers to get the rest and the support they need. And you can direct caregivers to www.caregiverstress.com, where they will find valuable information. Now, before we close this webinar, let's talk about the Arthritis Foundation and what it's doing to help and what research holds in the future. Slide. The mission of the Arthritis Foundation is to improve lives through leadership in the prevention, control, and cure of arthritis and related diseases. In addition to funding arthritis research grants to find a cure, the Arthritis Foundation pursues public policy and legislation on behalf of all people with arthritis. They also provide certified land and warm water exercise programs. So let's talk about some of those programs in more detail. The Arthritis Foundation's Life Improvement Series is taught by certified instructors and empowers people with arthritis through aquatic exercise and self-help programs that are proven to increase mobility and reduce pain, stiffness, and physician visits. The aquatic program allows those with arthritis to exercise without putting excess strain on joints and muscles. The gentle activities in warm water with guidance from a trained instructor helps patients gain strength and flexibility and enjoy decreased pain and stiffness. Let's Move Together, the Arthritis Walk, is the Arthritis Foundation's annual nationwide event that raises awareness and funds to fight arthritis, the nation's most common cause of disability. It is a tremendous opportunity to help improve the lives of the 50 million men, women, and children who are diagnosed with arthritis. While these programs help in the daily lives of arthritis patients, research holds the key to tomorrow's advances in preventing, controlling, and curing arthritis, and provides hope for a future free of arthritis pain. In the most recent Arthritis Foundation research update, Dr. John Hardin notes the need to identify biomarkers that can determine what kind of drug is most likely to be successful on a given patient. To accomplish this, the Arthritis Foundation is creating registries via 2 initiatives through which they will be able to analyze and correlate biological and treatment information for large numbers of people with the disease. The latest research update also includes information about how ACL injuries provide clues for early osteoarthritis development, and how a new study suggests high-impact activities do not contribute to the early failure of knee implants. So now let's take a look at some important resources on arthritis. Next slide. The Arthritis Foundation provides comprehensive information about arthritis through its 24-hour phone number and its website and its nearly 100 consumer educational brochures and books. In addition, it has a consumer magazine titled Arthritis Today. 50 million Americans currently have doctor-diagnosed arthritis, and by 2030, that number is estimated to grow to 67 million. Of those currently diagnosed, more than 21 million have arthritis-related activity limitations. And like I said earlier, as a result, arthritis costs the U.S. economy $128 billion in lost wages and productivity annually. So as professionals, the more we understand about arthritis and how to prevent, and more effectively treat it, the better resource we can be to our clients. As we close this webinar, let's take a look at some possible next steps. Slide. I hope that you found today's presentation both helpful and encouraging. And we've gone over a lot of information, and hopefully this information will be useful in helping you to support your client living with arthritis or their caregiver. Before we open the lines for questions, I'd like to consider the questions on the slide. I'd like for you to consider the questions on the slide and to think about what your next steps are. What resources do I need to explore to better understand arthritis and its impact on my clients? Do I need to discuss the issue of arthritis with my clients? What is the next step after this webinar to apply this information? So thank you very much, and now I'm going to turn it back to Steve to allow for some questions.
All right, great presentation. Thanks very much, Lori. At this time, we also want to welcome Dr. Eric Otterberg to the line for the Q&A session. So thanks for joining us today, Eric.
You're welcome.
All right. And as you can see from the slide up on your screen, it is time for the Q&A portion. So please send us in those questions for the Q&A portion here, and we will pose them to our presenters. Okay, so the first question here, I am ready to implement the Put Pain in Place program, but I do not have any volunteers who will help conduct the program. How should I handle this issue?
I'm sorry,
Eric,
Steve, is that one? Oh, Eric.
I'm not familiar with that program.
Okay, we'll move on from that one. What were the common blood tests ordered for diagnosis of arthritis?
I can do that one. So for osteoarthritis, there is not a single blood test or a blood test that is a unique identifier for osteoarthritis. For what groups into the inflammatory types of arthritis, most commonly rheumatoid arthritis. Lori very well covered those. Other blood tests for other inflammatory arthritis, such as lupus-associated arthritis, ankylosing spondylitis, all have separate individual blood markers. These are generally ordered by your primary care doctor or more frequently a rheumatologist. And if someone comes in with symptoms of arthritic, an inflammatory arthritis, they will usually order a panel of those tests.
Okay, next question. Is fibromyalgia categorized as a type of arthritis, and if so, when was it categorized as such?
That depends on who you ask. It falls into what's basically described as an arthritis-like condition. I believe the rheumatologist will group it into that area. I don't think the American Academy of Orthopedic Surgery has made a definitive statement, but they do address fibromyalgia as a disease of the musculoskeletal system.
Okay, and next question here. My 70-year-old mother has arthritis. She cannot tolerate most drugs and has only been able to take Tylenol, but it's not really cutting the pain. Is there a drug available that won't cause nausea?
Okay. The nausea is very patient-dependent. Not all people will have nausea to any given drug. Tylenol is one of the safer medications used, particularly in the elderly. A lot of elderly patients cannot take the NSAIDs or your ibuprofen Aleve or prescription NSAIDs for several reasons. Sometimes it's concerned with hypertension or gastric bleeding, renal insufficiency. There's a whole list of those. So Tylenol is safe, but again, a lot of times doesn't work. Other options for medications that people will use for the treatment of arthritis, osteoarthritis in particular, glucosamine chondroitin is widely available, quite popular. The evidence-based studies are not conclusive on whether it is helpful, definitively helpful or not, but I generally, my experience is that about 50% of my patients do get some relief. Others do not. People will sometimes use a medication called tramadol. It's a mild narcotic, which can help some people. We try to avoid the use of stronger narcotic pain medications for the long-term treatment of arthritis simply because those medications tend to work well for acute pain, but however, for people with chronic pain, particularly as people get older, they have fairly significant side effects, including some mild respiratory depression, balance issues, and constipation.
All right. Okay. Next question here. We were talking earlier about the benefit of better sleep. So the question is, I have not slept through the night in the 6 months since developing osteoarthritis in my hip. I'm constantly awakened by the aching or sharp pain. Do you have any suggestions?
Yeah, I hear that frequently, and usually that comes with the end stage of hip arthritis. People can try different positions. Some people can sleep with a pillow between their knee, but quite honestly, that is usually the presenting complaint, or when patients who are frequent patients might come in and decide they want to proceed with hip replacement because it does affect their sleep and their quality of life. It's not relieved with medications, and that's usually frequently when people will decide to proceed with surgical intervention.
Okay, we got a couple questions here that kind of relate to exercise, so we're going to segue into that one. The first question here is exercise a good prescription for all 4 of the arthritis types?
Laura, do you want to do some of these, or do you want me to keep going?
Sorry, I had you on mute. No, go ahead. You're the expert on that.
Well, that's okay. Exercise is good in general for a couple of reasons. One, it helps keep your body weight down, as Lori described very well. Keeping your body weight down is key. In general, for every pound you lose, you take about 4 pounds off of force off your knee and hip joints, particularly when you're going up and down stairs. So in general, exercise is good. I have become a big believer in aquatic therapy simply because you can exercise, you can get the benefits of exercise without the high impact on the joints during the exercise. When people have significant arthritis, it tends to make it more difficult for them to exercise because the pain that they encounter after they get done exercising.
Okay, and our next question kind of refers back to that as well. The question is, exercising while in pain actually seems counterintuitive. Can you please explain more fully and how to explain this clearly to our clients?
Yes, that is very difficult because people will have the pain. I guess I look at it and when the pain occurs. So if people have some joint pain and stiffness initially with exercise, it gets better during the exercise, and when they're completed the exercise, they don't have the pain. I find that to be beneficial. If it's the point whatever exercise they're doing causes significant pain throughout the activity and after the activity, then it gets to the point where it can be a little counterproductive, and maybe a different type of exercise program might be considered, again, something like aquatic therapy.
Okay, can you recommend any supplements for osteoarthritis?
That is a bit of a tricky one. There are several supplements that are touted to be beneficial for osteoarthritis. And again, if you look at the evidence-based medicine, there's not a lot of high-quality double-blind studies that look at this. The glucosamine chondroitin is probably the most common, and again, has been shown, particularly in laboratory tests, that it does, at least in dogs, that if you do take glucosamine chondroitin, it does get deposited into the joints, particularly the knee joint. It's relatively safe. Other people will talk about, I've had people use cherry juice. There's numerous nutritional supplements available. Again, we don't have much data out there for this, But what I feel in particular, I tell my patients, is that if what you're taking has no bad side effects to it and it makes you feel better, I'm all for using it.
Okay, and you just were talking about various foods and things. This kind of ties into that as well. Besides red meats, what are some other common foods that need to be reduced for the treatment of arthritis?
Red meats have been shown to be one of the foods that need to be reduced. People who sometimes will get gouty arthritis, that's particularly important for. Again, I just more emphasize a healthier diet to maintain body weight, as well as taking the foods, again, that which Lloyd talked about, which tend to be more nutritional, have foods of higher nutritional value. But otherwise, keeping your alcohol level at a reasonable level is, like we found out for a lot of diseases, is important. Limited or moderated use of alcohol, particularly wine, has been found to be helpful in treatment of a lot of diseases, but obviously overuse is more harmful than helpful.
And so, Eric, when you say moderation and keeping it at a certain level, what roughly should that be for your adult male?
No more than a glass. Yeah, no more than a glass of wine a night.
Okay. Okay, next question here. How new is the use of joint fluid injections, and is it a long-term solution? Is there risk of the fluid migrating outside of the joint?
So when we inject joints, I'm thinking the question is probably referring to what people talk about as viscosupplementation or the Hyalgan injections. Those injections are for lack of better words, almost like a joint lubricant. Very rarely do anything injected in the joints migrate. Sometimes steroids will exit the joint, and people who are diabetic have to watch their sugars. But the viscosupplementation usually stays within the joint. Any injection into a joint is not a long-term fix. But again, as we've discussed, there is no long-term cure for arthritis. On average, intra-articular steroid injections last about 3 months. Usually the first injection someone gets lasts longer, and eventually with time they have a shorter duration. And in terms of the viscosupplementation, that would be your Hyalgan, Synvisc, Suparts type brand names. They average usually about 6 months, but some people have, that's a high end of an average, I would say. Some people have less than that.
Okay, what are your thoughts on using artificial knuckles to relieve arthritis pain?
I am a hip and knee replacement surgeon, so I don't have a lot of history with that. They've been around for a long time, and they've had intermittent results. If you're going to pursue that avenue, you want to make sure you've met with a qualified hand specialist, whether it be an orthopedic surgeon or a plastic surgeon, and make sure that they have done a fair number of these. They were fairly popular at one time, and they kind of wax and wane in popularity. Okay,
how can I motivate a person with arthritis to make lifestyle changes?
Oh, if whoever asked that question can figure it out, I'd love to know how to do that, because it is a very difficult thing to do. And that person has to get to the point where they've decided they want to do this. I emphasize mostly overall health, and I very frequently use for every pound you lose takes about 4 pounds of force off your joint. That tends to work well with my patients, but until the patient is really ready to make that commitment, it's a hard thing to do.
Okay, what are the best exercises for a patient that has had a hip replacement?
Hip replacement in general, we try to avoid higher impact exercises. One in particular, when we test hip replacements in the laboratory to see how much wear they generate, we actually have a machine that replicates stair climbing. So that's how we try to generate wear in a test. So I usually recommend people avoid the step mill or the stair climbing machines, but walking, riding a bike, swimming, golf. I will let patients play doubles, tennis. I think are all very good exercise to do. I have my patients try to avoid the higher impact things like long distance running. Most of my patients don't feel comfortable running with hip replacement, but I I have them limit that if they're going to participate in that activity.
Okay, and now what are some warning signs of arthritis that I should be watching for with my clients?
Particularly in the elderly patients, joint pain, decreased mobility, and swelling in the joints are really, and Lori covered those nicely, are really the three things that do that. As you get in the elderly, you see a little bit more of stiffness, limited mobility, and joint pain are the most frequent things we see.
And what is the best way, to work with our clients to convince them to go in and get this checked out if we suspect that they might be developing arthritis?
I think the biggest thing is most elderly people really strive to maintain their independence and the quality of life and their level of function to keep that independence. So I really try to emphasize that portion, saying, not all arthritis requires surgery. As an orthopedic surgeon, I probably operate on 1 of every 15 people I see. We do lots of injections, medications, and other therapies that can help people treat their arthritis, control the symptoms without doing any surgical intervention. I think one of the biggest fears is people think that if they come to see a physician, particularly an orthopedic surgeon, that means they're going to have surgery. That's indeed not the case.
Okay, does exercise cause osteoarthritis for healthy joints or in any way worsen arthritis for folks already suffering from arthritis?
There's been no evidence-based data for either of those two things. There is no sign that doing exercise, even some of the higher impact exercises, will cause people to develop arthritis. And again, sometimes the symptomatology of exercise and arthritis, again, if you're doing an activity that routinely every time you do it causes pain during the activity and afterwards, it's important to continue to exercise. You may just want to pick a different activity.
Okay, what exercise limits are there on knee replacements?
That depends a little bit on the surgeon you discuss with, but in general, running on knee replacements is, again, not an ideal form of exercise, but like hips, walking, ride a bike, swimming, I also let my knee replacements play tennis, particularly doubles, but I have some that do singles. High-impact things over a period of time probably generate a little bit more force and probably wear on the metal and polyethylene or the plastic in the joint.
Okay, so how do you know when to differentiate, when to use cold and when to use heat for osteoarthritis pain?
That's a good question. I'm frequently asked that, and there really isn't any clear-cut answer to that. In general, when people are done with an activity and have pain, I usually recommend ice and cold. But usually what I tell my patients is find what works best for them and use that. But again, after activities, ice usually works better than heat, or cold works better than heat.
Is it potential that heat or cold can work in alternating benefits to a particular individual?
Some people do that. They will alternate heat and cold and do find it to be beneficial. Again, there's not a distinct evidence-based study that shows one or the other. It's just important that when you are either doing heat or cold, you always maintain something between the skin and the heat and cold source to avoid burns from either, which can cause skin irritation or burns.
Okay, is the step machine okay for a knee replacement?
Again, that's probably not an ideal exercise for knee replacement. A lot of people after knee replacements still have what's called anterior knee pain or patellofemoral knee pain. That's irritation of the kneecap as it tracks up and down the component. I think with any type of exercise, particularly as we age, the best thing to do is to do a circuit of exercises, not do the same machine all the time. Not my favorite exercise, but not a definitive no.
Okay, and how about ellipticals?
Elliptical works pretty well. A lot of my patients with knee replacements and hip replacements do the elliptical. Again, ideally one that can be a little more horizontal than vertical tends to be tolerated better. And again, those are low impact on the joints, so they don't generate as much stress across the implant.
Okay, how can I keep a person with arthritis comfortable and safe in their home?
Oh, that's a long question. I think the key is to try to treat the symptoms by the way we've talked, not over-medicate, because that is associated with falls. And as people get older and fall, there's a risk of osteoporotic fractures, which have extreme consequences. I think in terms of the medications, if Tylenol works for most people, that tends to be ideal. If they can tolerate the anti-inflammatories, they tend to work better. Coming in for intermittent injections into affected joints could also help as well.
Okay, can knee braces be effective in mitigating arthritis knee pain?
Yes, and we don't necessarily know why, but braces have been shown to be effective. One of the philosophies behind that is that a brace enables you to have a little more proprioception or enhanced proprioception around the knee joint. Proprioception is your ability of your body to know where it is in space. That's why you can close your eyes and touch your nose. There is some data out there that suggests that because of this enhanced proprioception, your muscles will fire more quickly and stabilize the joint, preventing some of the movements that can cause pain in arthritis.
Okay, now how about a rowing machine for exercise? It's more horizontal. How would that work?
No, generally that works pretty well as long as you're not getting too deep of a knee or hip bend to irritate that. But the rowing machine generally does work fairly well. Again, just not real tight and compact on that upward motion.
Okay, well, it seems like we are just about out of questions so far, but I want to thank our presenters, Lori Owen and Dr. Eric Otterberg, for joining us today. Thank you very much for a wonderful presentation. We appreciate you joining us.
Thank you for having us.
Thank you. Yes, thank you very much.